As eye care professionals, you've all heard the statistic, 50% of the world will be myopic by 2050. But how can we deal with this pending influx of patients? I'm Dr. Ken Nischal, and I'm here to tell you why optimizing your workflow in the heat of a busy practice might be the answer, and give you some practical tips that you can use today to prepare for what's coming in myopia tomorrow. The way we work, the way I work, I sit everybody around. If we've started a new center or if we know we're going to be offering a service, we sit everybody around. I'm very lucky I have fellows and residents. I make them go and do a literature search about whatever we're going to look at, in this case myopia, and then we sit down and we form a clinical effectiveness guideline. That is a consensus-based, evidence-led guideline. We all agree that this is what we're going to do, and we have the MDs, the DOs, the ODs, the orthoptists, and the techs, the ophthalmic techs, all involved as stakeholders. You've got to create a workflow. If you have a poor workflow, the experience your parents and your patients are going to get is going to be poor, and you are going to get sort of overwhelmed and think, I don't know if this is worth doing, slows the clinic down. You've got to optimize the flow. Optimize the flow, and it'll be effortless because it's like a well-drilled machine. So we have clinics where my optoms are only seeing myopia patients. It's so well done that we can get through 30, 40 patients without them breaking a sweat, because everybody's doing a little bit, and it works. The other thing that I think is really good, and I think this is really important, is to make a video, patients and parents. And before they come to us, if we've had like a failed vision screening, or we get the pediatrician saying, oh, the child's parents are nearsighted, but I think the child is nearsighted, we send a link to these videos to them. Because when they come in, now they already understand why they're coming in, what's going to happen, and what the options are. So my conversation with them, my chair time is reduced because they've already got this information. So if you've got a busy practice, you can definitely incorporate this, but it's also very important to understand that you might be seeing somebody every 6 months. You've got to understand what the exceptions to that is. You get a phone call and the parents say, you know what, we just got glasses and they're not working, or the child seems not to be moving or being as functional. You've got to see that child earlier, make sure that they didn't get the wrong glasses made. And you've also got to explain to them that if they get, for example, low-dose atropine, they may start to get difficulties with reading. And you have to warn parents about this. And all of that can be counseling on a video so that they've got that at hand. So I think that those are my nuggets, if you like, for incorporating myopia management in busy practices. I would strongly recommend, and this is a plug for the WSPOS consensus statements. We've created consensus statements that are for doctors and eye care professionals and optometrists and orthoptists, but we've also created a cartoon version for parents. And it basically says what does work, what doesn't work. And what does work, we give sort of simple explanations as to why it worked. You have got to know your literature so that when something new comes along, you can decide to adopt it or not adopt it, depending on your foundation knowledge. We have a workflow that's been agreed by all the participants and all the stakeholders, and they tick it through, and there are all these red flags. Like I said to you, if the child has other problems, if the myopia is greater than their age. Actually, this is a real case. So I was taking a family history, and the child's father died from an aortic dissection. Now that's not usual, right, in a young person. He was 37 years old. I said, wow. See the child had Marfan syndrome, but it hadn't been recognized. They didn't even recognize that the father had Marfan syndrome. So again, there are these there are these red flags, and we've put them down, family history of somebody dying unexpectedly from a cardiovascular problem or a brain aneurysm or a brain hemorrhage. Make sure we're not dealing with a connective tissue disorder. So, the other thing that they ask the children is, do you have any problem at night with night vision problems? And if a child says they have night vision problems, often the parents say, oh yeah, always bumping into things when it's a bit dim or dark. Then we normally get an electroretinogram at some stage to make sure they haven't got a retinal dystrophy. By putting these flags in and saying, if you see this, this is what you do, clinical effectiveness guidelines are just amazing. They really are really, really good. And they don't hamper a doctor's or an eye professional's autonomy. What they do is that they make it easy not to miss something and easy to deliver good care. The way you make people feel cared for is to make sure, number one, they get all the information they need. I don't know if you've heard of AIDIT. AIDIT is an acronym which says acknowledge, introduce, duration, explanation, thank you, right? All of my staff do that. So they acknowledge the patient, the parent, they introduce who they are, what they're going to do, the duration, they tell them, I'm just going to measure the length of the eyeball. This will take 5 or 10 minutes. And where they're going next, an explanation as to the flow, which they normally understand because they've seen a video. And then at the end of it, is there anything we've said today that you didn't understand? And I want to thank you for your patience, and I'm glad you're here. These are the things that make people feel special, because they feel like, you know what, they're treating my child and me as someone who's important. But it doesn't have to take 20 minutes to do that, It just has to take a little bit of effort to get the flow right, and everybody's speaking from the same hymn sheet.